Hi Osman, a very good morning to you. Uh,
And to you?
so today we are meeting with a topic for as you are an inspirational character because you have done your MBBS from Sudan, which is in North Africa, and now you are doing further studies in UK. So can you tell me like how was your MBBS journey in back in Sudan?
Well, a little known secret of mine. I actually went to Sudan from my country's citizenship, which was in Ireland. I was raised in Ireland through most of my schooling education, mostly through primary and secondary school, and I went to Sudan. I went to Sudan there for my degree. I'm originally from Sudan myself, and it was a 6 year degree. Some schools offer 5 year programs. Other programs offer the MBBS over 6 years. However, I chose the particular program that I went to for my MBBS because I preferred their system of training, and also whereby more and more schools in Sudan are going through course-based training programs. This one stuck to a very tradition which was used by the UK back in the 1950s and 60s, and since then they've adhered to it in two top institutions, namely the University of Khartoum, whereby we adopted a similar system in this university. So we've been studying by years, and the way that worked was by studying through the whole curriculum across the term, from usually from around October until the end of May, and the final exams would be an accumulation of all the material that would be throughout the given year. So even though it may seem tough to the untrained eye, I found that it suited me very well because I also thought that it might be a tool for me to retain more of the information that I've acquired during the years of study as well. So
Okay.
since then since enrolling, dived into many I've entered into many different things, in addition to my academic rigor, mainly in the name of policy management, and also in policy development, namely in both in public health and in medical education as well, through IFMSA.
So when you decide that you should pursue your further career in UK, so in which year
So
you have decided?
so I've initially decided to pursue the UK route, owing to first and foremost my family being nearby. I was raised in Ireland next door, so it made more sense for me in that respect. But from a professional perspective, I thought that even though the UK route seems to take quite a longer time, um, in some training programs it can take 3 years, but in other programs it can take 7 to 8 years, depending on what you'd like to do. So I thought, particularly because of the foundation training year program, I was a little bit indecisive during my final year about what I wanted to do. Although I did suspect that I would like to go through either the pathway of community medicine or public health, or also during the through the surgical programs. So what really attracted me to the UK was the foundation program itself, whereby rather than four rotations, excuse me, over the course of 12 months, we'd have six rotations over the course of 24 months, and these would also include major specialties as well as other minor specialties as well. So I can break it down for you over the 2 years. In my first year, I first rotated in ophthalmology, and then in respiratory medicine, which was during a COVID wave, and then in general surgery. So then moving on to my foundation year two, I did a 4 month rotation in general practice and primary care, and then that was followed by psychiatry, by adult psychiatry, and then it was concluded with a rotation in gastroenterology. So as it stands today, I'm currently in the process of applying for specialty training, and yeah. I still have two
So
options.
out
So
of the
narrowed my
foundation training subjects, out of the foundation training subjects, which subjects you want to take as a specialty training?
I enjoyed the first one the most. I enjoyed ophthalmology the most, so that's what I'll be aiming towards. And also at the same time, strategically, I also do have academic interests that I'm pursuing as well. So there's also that little chance as well that I may be applying towards a master's degree in global health.
Okay, okay. So if someone did some experience from like home country, like you're from
Mhm.
Sudan, if someone is doing after MBBS some experience from Sudan or for me like India, is it acceptable in UK? Like, is there any way that the foundation years can be reduced?
Well, so the main reason why I entered into FY1 was because I entered directly after my medical training through MBBS. But generally speaking, if you were to apply to the UK, some people opt to apply to what's called the F2 standalone. So they only undertake the F2. Some of them apply to trust grade posts or non-training posts for a period of up to 12 months before applying to specialty training. But the general rule of thumb is that once you were to complete your provisional registration after graduating from your MBBS, you generally wouldn't be eligible to apply to the full foundation program, so FY1 and FY2. During FY1, we have provisional registration, and FY2 we have full. So the minimum that you can apply to if you were to acquire your full registration in India or Sudan or wherever, and then coming into the UK, the minimum post that you would apply to is FY2 or an equivalent post. And these would be in the names of like these may be in the form of clinical fellowships, trust grade posts, or locally employed doctors.
So when actually people give the MRCP in UK, like MRCP or MRCS in UK, like after specialty training.
So with regards to the Royal Colleges, the exams themselves, they're held on multiple dates throughout the year, but they're generally a requirement which should be done in your core training during your specialty training. However, there are some in previous years, it used to be marketed better in the sense that because these exams are worth points on your portfolio, some candidates for these specialty programs may opt to sit at least part one of whichever Royal College you intend to undertake for its specific training program. So overall, it's it can be preferred by some specialty programs if you were to take it before you enter specialty training, but as a general rule of thumb, they're taken during specialty training, particularly during the core years.
So what's your current plan, like for specialty training, and then go for MRCP or direct or go for a PhD?
So again, ultimately, it depends which line I'm going towards. So I've opted to apply to the GP route or the ophthalmology route. So in the event that, for example, I was to go through the ophthalmology route, it would be a case of sitting the part one for the FRC ophthalmology. So as a caveat, on ophthalmology they only offer fellowships, not memberships. So it's a direct route to fellowship. So it would be FRC ophthalmology part one during your first 2 years of training before you become a higher trainee or registrar, and then at least part two by the time within the first 3 years. And in order to achieve consultancy, there's a third written part which is completely practical which must be passed in order to obtain the FRC off, and in order to achieve a consultant post. However, when it comes to the GP route in comparison is only 3 years training. So it would be a case of sitting the MRC GP part one ideally after your first year of training, and then your and then part two, which is the applied knowledge test, ideally at the end of your second year of GP training, and then completing your membership with the Royal College of General Practitioners at the end of the third year of training, and then it's at that point you'll be a qualified GP.
So now it's UKMLA rather than PLAB. The name has been changed. So what do you
It's re-
think?
it's
Like,
been
what does yes, the exam pattern has been changed? Like, have you contacted with those people who have given UKMLA? So is there any change between PLAB and UKMLA in respect to question or exam strategy or something?
well. As for myself, for someone who's gone through the PLAB route, if you were to compare it to the UKMLA, I wouldn't suspect there being much of a difference. However, medical schools are now tailoring their curriculum in order to achieve success rates within the UKMLA. So it's almost practiced in the same manner now as USMLE. So you can opt to prepare for it independently. However, within the UK, medical schools are now tailoring their curriculums to prepare for UKMLA. But the overall principle within itself isn't very different to the PLAB, in the sense that paper one, I'm not too familiar with it, to be honest, but I think it consists of two papers, and UKMLA also consists of a practical part, which would be equivalent to final year OSCEs in medical school. The UKMLA in itself this year is being taken by final year medical students
Yes,
in the
yes.
UK.
So both the things are more or less same then. The PLAB, the name has been changed, the question patterns are all more or less same.
More or less the same, I would imagine, yeah.
Okay. Okay. So do you have you any plan of getting back to Sudan or you will stay in UK only?
Well, I do have intentions to return after completing training, and also I also feel quite an urge to raise the next generation of medical students as well, as an academician. It's always been something very dear to my heart. Since I submitted my MBBS research thesis, I've always been very invested in the field of community medicine, public health, and it was of even more relevance as well shortly after graduating during the COVID-19 pandemic. So since then, I've built up quite a substantial research portfolio, and you can feel free to see my output through ResearchGate and through PubMed, and likewise through Google Scholar as well. So through that, hopefully I'll be aiming to undergo a master's degree, and also complete the academic ladder as well in Sudan, hopefully in the near future.
So in UK there are a course called Masters in Research, MRes. So, like,
Yes.
is it possible? So, someone is in the foundation training and laterally he or she is doing a score like master's degree, like Embrace or MSc or something. Because I've seen people has done like MBBS, MPH or MBBS, MSc. So, is it
Yes.
possible to go like for the training also and simultaneously the degree also?
You can, yeah. Particularly now with the advent of some flexible programs which can be done completely online. But even after enrollment, you still have the opportunity to use resources in person as well, such as libraries and internet access and so on. So if someone were to ask me if it was a simple yes or no question, I would say definitely yes, it is possible to merge pursuing a master's or PhD with your specialty training.
So currently you are in which city in UK? London.
Currently, I'm in Hull on the northeast.
So what is the expenses, monthly expenses to stay there, like for as a doctor? Means what is the average expense of staying there?
Well, it depends ultimately what you're looking for. I mean, as a bachelor myself, I've been living in rooms
Yeah, obviously, a
in shared
bachelor,
accommodation.
doctor, and
Yeah.
average, this decent lifestyle, not a very overish lifestyle. It's a decent lifestyle. What will be the average cost of living?
For the average cost of living, I would say you can find rooms and studio flats with all bills inclusive for around maybe 600 per month, 600
600
pounds per
pounds.
month.
Okay, so in including rent and groceries and transport, everything.
Transport ultimately it depends. It depends where you're working. I don't work locally, so I tend to take the bus or the train to work. So I would spend around 100 pounds per month because I just need to take the bus rather than trains. And in terms of groceries, there are some shopping outlets where you can easily shop once a week for around maybe 50 pounds per month, 50 pounds per week. Excuse me. So
So if someone is planning maybe from a low middle income country like India or Sudan, if
mhm.
someone is trying to go to UK by giving UKMLA, so what is your suggestion to them in respect of study and in respective of the money? Because money is a big thing. So
It
what's
is.
your like what's your suggestion to them? Do like in how to like how to spend money and what's the study like how to prepare for the exam, because what I got there is a app called Plabable and everyone is telling them go and do the Plabable app. So what's your suggestion in this case?
So first and foremost, these are both soft skills when it comes to financial management and also in terms of in study preparations. So beginning with study preparations, seeing as though that's more adherent to the two, I would say that as a soft skill, when I was in medical school, I was task oriented rather than time oriented. So, for example, if I wanted to revise some notes on a particular system, for example, if I wanted to revise the female reproductive system, for example. So rather than aiming to see how many you can get done in an hour's time, I would say have a set number of tasks, have a set number of tasks to be done before before you complete, irrespective of how long it takes, whether it takes you 90 minutes or whether it takes you 3 hours. Ideally, that's the best time. But also, don't ignore your breaks. Have yourself a break every hour or so in order to maintain your attention span. I wouldn't go beyond an hour, and then have yourself a short break, 5 or 10 minutes. Also, as well, when it comes to when it comes to studying as well, also make sure you're looking after yourselves and eating properly as well. I would avoid I would avoid high carbohydrate diets as much as possible before, particularly during the exam period. Um, Also, and sticking to whole foods as well, single food ingredients. So this coming from experience, your physical your physical health will improve. Your cognition will also improve as well if it's on a consistent basis. Within a month or so, you will see great results if you stick to single ingredient foods and stick to low carbohydrates and high protein diets.
That's
So this is from
fantastic.
this is from a soft this is from a soft skills perspective when it comes to studying, and also from a dietary perspective. And in terms of resources, Um, in addition to Palpable, I can also recommend Past Medicine, and also there are some other resources that you can use. such as the Genius Plus, or also colloquially known as Samsung. This is also a very popular resource, and the subscriptions are also very affordable as well by comparison to other resources. But from a financial management perspective, I would say the best thing you can do in terms of dividing your monthly salary would be to use the 50/30/20 rule. So 50% of your salary for what you need, 30% of your salary for what you want, and 10% that you put into a definite savings pots. So if you were to stick to that rule, religiously, then affordability for the things you want shouldn't really be much of a problem as well, from my perspective.
Fantastic. Like in India, like the postgraduate entrance exams are very tough, and people used to leave everything because of studying.
Mm.
So yeah, like do you recommend that when you have prepared for PLAB, so are you working in Sudan or you have taken a study break for the exam?
So I took a study break for the exam. After graduating, I left Sudan and returned to Ireland. And during the s- during the 12-month period, I my initial plan was to do my internship in Sudan. However, there was some political instability at that time. So it was at that time when I opted to return to Ireland. So during the forthcoming 12 months, that's when I took the time to revise and to sit for the exams. And also at the same time, whilst I was sitting at home, develop a research portfolio as well, because that was worth points for applying to the foundation program.
Okay, okay, that's great. So if someone don't have a research portfolio, is it possible to get the foundation course in UK after passing PLAB?
Yeah, absolutely. So ultimately, what you need is your dean statement as proof of your graduation, saying that, for example, this is to certify that Dr. Dattatre Mukherjee has completed the MBBS training program and has graduated on this date, as proof from your dean, and a sound credibility that you are in a sound position to apply for the foundation program. So
Okay,
then what you need, is your decile ranking, during your program, whether you ranked in the first decile, or whether you ranked in the first, second, third, or so on. However, and there is a caveat here, because if you were to go in and you didn't provide a decile ranking, you can still apply, but by default you will be given the lowest decile ranking. So do please make sure that you obtain your decile ranking from your school's dean before you apply. This is the best advice that I can give.
okay. So I have seen people have passed the past PLAB, and they have passed GMC also. Like they have got a GMC also, and then they are completing further degrees in country like India, and they have planned to go to UK after completing the Indian degree. So, is there any timeline that with the GMC degree where you need to apply foundation course in this much many months, within these months or something, like
Hmm.
within 3 years you need to apply, or is there any timeline?
So generally speaking, with the GMC, is that once you begin your foundation training, you have a period of 3 years. Your provisional license is valid for 3 years, with the GMC. So this is in the event that you've already started your training and you have a license to practice. However, if you have GMC registration but you do not have a license to practice, then it's in that case that you don't need to engage with the appraisal process, but you do need to maintain your registration by paying the annual appraisal fee. So I wouldn't say that if you're to if this is before you acquire your license, I wouldn't say that there's a definite timeline. However, I would advise that once you apply, do your best to apply as soon as you can.
So the thing is that the license is you are talking about GMC license or the country of nationality license.
I'm speaking with regards to the GMC license.
GMC license. Okay. So when someone is passing the part two of the PLAB, then first they are offering provisional license.
This is in the event that you haven't obtained. If you haven't obtained full registration before, then they'll give you a provisional license. But if you've completed your internship that would merit you full registration in any country, then
Okay.
then you would
Then they
opt
will give
to
the permanent
then you opt
license.
for they'll give you the permanent reg,
So
the full registration.
so it is depends on the main nationality country also, because if they have a permanent license in that country, then GMC will give you the permanent license. Otherwise, provisional license.
Yes.
Okay.
Yes. Yeah.
Okay. I got the point. And so how is the work culture there in you back in UK? Like how you are feeling? Like
Well, I can't say that it's been. I can't say that it's been that that has been that there has been the element of there being a cultural shock. But in the event that something goes wrong, or if there's anyone that you need to refer, there's always specific channels that you need to adhere to for any given situation. So, for example, if I needed to if I needed to report something, for example, a lot of in I would imagine this being in many third world countries, that if something were to go wrong, then usually interactions are face to face. However, in the UK, if something were to go wrong, then there's specific channels and different email trails that you need to follow in order to in order to solve any existing conflicts or problems. But generally speaking, the work culture there's there is a hierarchy, but not as much as I experienced in Sudan. Doctors and nurses work hand in hand, and neither side can function without the other.
okay,
Neither side can function without the other. So doctors and nurses, they work in tandem. They work in tandem with each other in order to create a holistic plan of treatment for their patients.
okay,
So it's not a case of one profession versus the other. They work in
okay.
tandem to create a holistic plan for their patients in order to optimize patient safety and patient care.
Okay, so we have 10 minutes more. So it's a wonderful to know you personally, because we are meeting for the first time, although we know each other from the COVID time. But for the first time, we are meeting to hope we will meet in person too. Because personally,
I do hope
I'm
so.
preparing for PLAB. Like I am preparing to give it in this year. So some of the questions are mine, and some of the questions I see from different platforms. Uh, so if you want to go back to Sudan today, what thing you want to bring with you from UK? Like what in the healthcare system? Like what change you want to do in Sudan healthcare system, which you have you if you go today, then what's your perspective? This is the last
Well,
question.
the list is quite extensive, but if there's anything in particular that I would bring back, at least from a clinical perspective, then what I would do is I would update and sophisticate any reporting mechanisms and any referral processes as well, so that in Sudan, as in any country worldwide, the first point of country so the first point of entry into any healthcare system would be through primary care, rather than through rather than having to seek private healthcare, which would tend to compromise salaries, and also which would also impose quite a severe financial hardship among the Sudanese population. But from a health policy perspective, if there's anything that I've noticed, that's very if there's anything I've noticed that's very prominent here in the first world compared to what I've experienced in Sudan, it's that some medications remain unregulated, namely antimicrobials, and I would like to play a part to introduce a health policy in order to stem and control the use of prescription antibiotics in Sudan. That's always been very dear to me since I
Antibiotic
submitted my
resistance
MBS.
is yes, it's a big problem in, I think, in low middle income countries. Currently, the upcoming big problems will be the antibiotic resistance, and people are talking also that AMR.
It's
So
it's been it's been an issue that's been very dear to me since my days in medical school, and it's what my thesis was based on.
okay, wonderful.
And since then, like knowing the impact that you can do, even if it's just with one paper or poster, there's always that drive to do more. So here I am.
But it's good that we medical professions have identified this problem earlier, because otherwise it will be a problem later. But we have identified it, but it's that we should work with the proper guidelines.
I would say so as
O-
well.
Okay, so have a wonderful day. It's a Sunday for you.
You too.
Yeah, yeah.
Uh,
For
it's
me,
um,
it's
it's it's
like
Sunday for me, yeah.
it's like it's 9:23. So it's evening for me and it's the morning for you. You have a whole day. So have a great day. Most of the many questions you have cleared. So I think there will be more questions, and I will approach you to clearing all the queries, because we do have many queries and the things are also changing because the medical education is changing. So examination patterns are getting changed to what we have done in before, and maybe in next 5 years many things will be changed. Not only syllabus
I would say so.
in question pattern or some on many things will be changed, because that these things are also evolving. And happy Ramadan to you.
Thank you
So
ever so much.
enjoy your day. So this is anything from your side as a concluding remark.
Where can I meet you in India? Are you in Mumbai, Delhi, whereabouts?
I'm from Kolkata actually. It's
Oh,
east side of India.
on the east side, yeah, yeah.
Yeah, you
So
it's near Bangladesh.
yeah, yeah.
Okay, so
So hopefully, whether you meet me here or I meet you there, we'll meet soon.
yeah, if you come to India, let me know. I will give PLAB by this year or next year. I'm planning, because before that I have my country like postgraduate entrance examination. So there is couple of plans I have. If I go
Hmm.
to UK, I will surely knock you through WhatsApp. So we'll meet somewhere.
Thank you
Okay,
so much.
thank you. Thank you for giving
Have
me
a
the
good.
time and accepting the invitation. Um,
It's my
I will,
pleasure.
after posting it to the YouTube, I will send you the link.
Okay, great, great. You take care.
Thank you. Thank you.
Thank you so much.